In today's video, we're going to be talking about spine anatomy. So the anatomy of the body, right? We look at the anatomy of the body. The anatomy of the body. The actual physical structure. So I happen to bring a friend with me. His name is Seymour Bones. And when we look at the spine here, from the back, the spine should be nice and straight. And from the side, there should be natural curves and contours. Now, when we look at the specifics of the spine, there's several things that we need to know. So the first thing that we need to know is that there are bones, there are discs, there are nerves, okay? And again, we're talking about the spine, we're not necessarily talking about the nervous system, but we need to take that into account because there's two areas of the body that are completely surrounded in bone. The first one is your brain. Your brain sits protected by your skull. And when there's a problem, you could have a concussion, you could hit your head, all sorts of different things can happen that put pressure on your brain. The second thing is your spinal cord. So your spinal cord are branches of nerves that travel from your brain all the way through the center of the spine. So obviously this is not a full-length spine here, but we can look at the top here and we can see where the spinal cord runs through the spine. So literally from the top of the spine to the bottom here, we have a spinal cord that allows the body to move and bend. And so from an anatomy standpoint, again, we have bones, we have discs, we have nerves, and then on top of that, we have ligaments that actually hold the spine together. So when we look at the structure of the physical structure of the body, what allows it and keeps it, holds it together. The ligaments in your body actually hold your bones together. So if you have, oftentimes people have auto accidents and different things like that that can traumatize their ligaments, and it literally does not allow your spine to be held together in the right way. And so especially the more severe the injury, the more you can begin to damage the anatomy of your spine. But when we look at the specific contours, we see these bumps here. It's like the bumps on a dinosaur, right? You go to the museum and you see the bumps on the dinosaur. These here are called the spinous process. And so we want to take care of our body so that we allow a good balance of this structure. And so all these parts of the body, and you'll see how, when we look at it from the side, how the bones interlock with one another. And so all of these different parts allow the spine to work in a magnificent way. And so when we have good structural support for our spine, we can begin to take care of our bodies, because we have to take care of our spine for our entire life. Right? We're not going to just take care of it this year or next year or the next 10 years. You're going to be in the same spine for your entire life. And I promise you, original parts are the best. Okay? We don't want parts in our body wearing out and having to do more invasive types of procedures. And so in your life, you can look at the way that you're using your body and how you may be putting too much pressure on your spine. So we've got connections of nerves. We have the bones, the discs, the nerves, the ligaments, all of these structures so that we keep the body in a good position here, and we prevent the deterioration that can happen through improper use of the spine. So the spinal anatomy, we take care of our body, and so that you can live a long, healthy, active life. The next video is, what are herniated disc symptoms? Check it out.